I'm Catherine Hartman, and I have the privilege of leading the University of Kentucky Center for Clinical and Translational Science. I had an experience as a child with having surgeries because of an accident. What stuck out from that was, how can they be here taking care of me and not know the answer to my question? And it's really driven a lifelong interest in causal inference, understanding how things come to be with human health and thriving, and asking questions that really matter to getting those answers for the full range of healthcare. So some of my first engagement in research was in actually synthesizing data for evidence-based practice, informing policy and legislative settings as an undergrad, having the privilege of going to Capitol Hill some, and then starting out as a science writer and asking people to document where their thoughts or ideas came from. Clinically, I'm an OBGYN, and obstetrics and gynecology is one of the fields that has been relatively bereft of research because it's hard to do. And so most of my questions have been driven by that level of skepticism that the right amount of high-quality information doesn't exist for women and their care providers. And so I'm most proud of the Right from the Start study that ended up recruiting thousands of women to have close to 8,000 pregnancies, a large proportion of those achieving the goal of recruiting women before they conceived, so that you could tease out the cause and effect. We were the first group in the country to definitively prove that risk for adverse pregnancy outcomes begin in African American populations as early as the first trimester. Then the last really important finding that we've had recently, in a large cohort with diary information about people's health behaviors, medications, medical conditions, and the things that they do in their life, including their alcohol consumption, to try and answer the question, is there a safe level of alcohol use in pregnancy? We were able to show, unfortunately, and against the beliefs of a lot of women and their doctors, there's really no safe level with respect to miscarriage risk. People who consumed as little as one alcoholic beverage a week over the first weeks of pregnancy had a cumulative incidence in risk of miscarriage up to and through the 9th week of pregnancy, and that was pretty stunning. That wasn't our hypothesis. The initial wave of funding from the National Institutes of Health emphasized translational research, which was the concept that if you brought some of these clearing the path features of assistance to scientists and collaborations across CTSA hubs around the country, that you could accelerate discovery. When you get good at something, the target moves. So the National Institutes of Health, through NCATS, which is the group that awards these, shifted the focus some to say, that's working. Now, how can you take that ability to accelerate science and begin to discover generalizable principles of what will work to deploy drug discovery, clinical care improvements, quality improvements, evidence-based practice, dissemination of those things that are not just evidence-based practice, but how do we support evidence-based prevention? How do we support models for community-based intervention that can work across some of the wonderful things University of Kentucky is doing? Hepatitis C intervention, substance use intervention, increased screening for cancers, all fall in that general category of how can we do particular methods better. Being the hub for a state that's deeply invested in the well-being of a state is unique and powerful. It's one of the things that drew me here. One of the most exciting things about the CTSA award is that your award is fabulously backed up, supported, energized by your health-related colleges and your vice president for research and your president's office and your provost. It's phenomenal to have 16 colleges on the same campus. I've never had access to ag extension agents in an agriculture school and equine research that has fabulous molecular genetics. I've never had access, even in roles where I'm looking to blend research and promote collaborations, to the number of experts in so many different locations. I believe the University of Kentucky really has it all. And I think there's a real heart of service, not just from the campus, but this relationship between citizens of the Commonwealth and this campus feels uniquely based in a trust that most universities do not enjoy. And being able to link researchers here and elsewhere to population groups that are very hard to engage in research. Very difficult if you don't have what University of Kentucky has, that there are people out there who actually touch the people and go to their homes and go to the firehouse and go to the library and go to the school. We're uniquely situated to help people who want to do the right thing, which is have representative samples of the US population in their studies. So it's both a leadership position, and we're able to do that sort of work, but also an inspiration that this is the sort of state and the university that could do it.